Good evening, everybody. Welcome to Greater Manchester LPC Annual General Meeting 2020. I'm Andy Chilton, Chair of Greater Manchester LPC, and I'm joined today on the panel with Vice Chairman Ifti Khan. Alongside us also is Treasurer Mohammed Anwar, and we've also got our Director of Pharmacy Transformation, Lovejeet Kandula, and also two guest speakers tonight for after the AGM, Andy Chilton from Velresco and also Nathan Wiltshire from Cambrian Alliance. Very, very different AGM to what we've had in the past. Many of you have attended our AGMs in recent times where we have moved actually to conferences and we try and provide a lot of CPD and training for you and a lot of awareness, but as you are fully aware, in the current climate we're not able to do so. So very different for us, and I'm sure very different for you, but although I know a lot of people have been attending a lot of webinars and a lot of training events and meetings, for us, this is the first time that we're actually broadcasting live to you all as contractors, and it might be the first time, first of many, as I say. Just so a quick run through for this evening. The first half an hour or so will be the AGM, where we'll give you an overview of the year 1920, which obviously we went through the operation review and the structure as an LPC, but also saw the beginnings of the pandemic. So we'll touch on that and the response to the initial response. Also, we've got Mohammed will go through the accounts for last year, and then we'll finalise the contractor vote and the Q&A session for any matters with regards to the LPC. After that, then we'll have Andy Chilton from Velresco talking to you around processes and efficiencies within the workplace and how we can free up pharmacists' time to moving towards models that we want to be around services and maximising income. And when we start talking about maximising income and our bread and butter and being margin on drugs, we've also got CEO of the Cambrian Alliance Groups, Nathan Wiltshire, who will talk to us around their solutions when it comes to margin. We'll have a Q&A session after that as well to go through. So moving into the evening, I've done my welcome. The actual year 1920 itself, I don't want to sound like a scratch record, but unfortunately it is a bit like that. Every year seems to get worse, has done ever since 2015, since the funding cuts. But what we did see within 1920 was some stability around the introduction of the community pharmacy contractual framework and also an agreement to an end to the funding cuts. So although not a great position in terms of contractors financially, we did see some stability start coming into the sector to think about what we can actually do. And I think also the same there for the LPC. We'd underwent our operational review, and we'll talk about that in a little while. Ifti will give us an overview of what the outcomes were. When we spoke this time last year, we gave you an outline of what we were going through. And we can now talk to you about what the kind of endpoint to that has been. Naturally, obviously, there was a big change in the team. So our operating costs were reduced, but also we've tried to do our best to work as efficiently as we can on your behalf, but then also to support you as best we can. We've had two PQSs, and they were very, very different. We saw obviously the introduction of the PCNs and the PCN lead role, and there was a lot of work to do this time last year around supporting community pharmacy in meeting PQS, and we did very well. Credit to the team at the time when they came in. People like Lovejeet come in, hit the ground running to support Ricky, who you will all know was with us from previous, but also the PCN lead. So that was some great work done on there. We did get out in 1920 to come and see a lot of you in a lot of the localities. I think we actually completed a number of our contractor visits, and that was the delivery of our contractor care plan. And the intention was to build on that this year and to come and see a lot more of you. Obviously, with the times have changed, and we need to start rethinking that, and we are doing that in the background at the moment. but then also looking at how we can get sponsorship and be able to then support you. But also sponsorship is not just about bringing money in. It's also about how we can engage and network with partners on community pharmacy's behalf to open up opportunities for us, to open up opportunities for community pharmacy in Greater Manchester and what we can do. So all in all, though, we are in quite a good financial position, which you'll see when Mohammed actually goes through the accounts and outlines to you all, and gives us a great stepping stone for us to be kicking on in the upcoming years. We've also, done quite well with the Healthcare Academy. Some of you may have attended quite recently the flu vaccination training, which we've still managed to put on this year via the Healthcare Academy, and we'll talk a little bit more about that on the successes that we've seen with the development and the stability of that structure as well. Okay, so now I'm going to hand over to Mohammed, who will give a quick overview of the accounts and anything financial.
Perfect. Hi everyone. Hope everybody's doing well and keeping safe. I don't know if you've had a chance to read the accounts in the annual report. However, I will summarise and give you an overview of those accounts. The accounts can be found on page 24 and 25 of the annual report. So moving forward to the balance sheet. So as you can see, our net assets are £600,000 compared to the year previous, where it was £503,000. So we do have a healthy amount of money in our account. I think over the years, I think the office and the treasurers have budgeted very well. We have used the zero-based budgeting method, which does help to scrutinise each cost effectively. Hence, we do get a surplus year on year. The summary of our annual accounts. So our total income was £598,000. Our total expenditure was £501,000, which leads us to our net annual surplus of £96,000. There's a number of reasons why we had a higher surplus compared to the previous years, and that was due to quite a few cost savings within the year, as well as we did a structural review, which Ifti will talk to you about later on. And this meant we had quite a few staff vacancies which had not been fulfilled, leading to a high surplus. So this brings us to the retained surplus of £600,000, which we bring into this year of 2020 and 2021. And figures in the brackets just represent what we brought forward from 2017-2018. We had £453,000, and in the year 2018 and 2019, £503,000. So there is a gradual increase of the net surplus year on year. Another thing to bear in mind is when you do read the accounts, you will notice that the LPC members' claim were quite high compared to the previous year. It was £62,000 compared to the previous year, where it was £31,000. This was expected due to staff vacancies which had not been fulfilled. Obviously, LPC members had to step in and cover with their time, hence that cost. So one of the key priorities for Greater Manchester LPC is how we use the levy effectively to support and to deliver for our contractors. And since we have retained high surpluses over the years, it is only fair that this money is given back to contractors. Therefore, Greater Manchester LPC has announced a reduction in the levy for this year, 2020-2021, which amounts to a 6-month levy holiday for contractors, totaling £150,000. What we will do in 6 months' time, we will review our budgets and our reserves, and if needs be, we will extend a further 6 months for contractors a levy holiday. Other key priorities include supporting contractors with the newly announced pharmacy quality scheme, primary care network engagements, patient and public awareness, and transitioning towards delivering the new CPCS and other locally commissioned services. Those contractors who are signed up to the weekly newsletters know that Greater Manchester LPC provide this information on a weekly basis, and this can also be found on the website. Thank you for listening. I'll pass you over back to me.
Thanks, Mohammed. Thank you for that. So as Mohammed outlined, so as I had also said as well, we do have quite a strong financial position, which has been a reflection of the way the LPC has been operating over the last, I think I'd say the last 2 to 3 years, especially since the merger. Obviously, we were in a very, very different place when we merged, in the sense of we were a bit unaware of what the new structures and the new ways of workings would bring. So it has taken a bit of time for stability to understand what the needs of operating at this scale would be, and what those costs also would be. So in the light of the operational review and looking at what the previous year has brought, we are definitely in a position where we are able to offer this levy holiday, but then also review what the costs are going to be for running the LPC going forward. And we'll obviously keep you posted as we move forward with that. So looking at the reflections and challenges for community pharmacy that we saw in 1920. So, I mentioned the operational view, and I don't want to keep harboring on that one because Ifti is going to be talking about it. But then also we saw a change in contractor numbers, a sign of the times. So there was a reduction. We went from 618 in the previous year down to 609, and we probably do anticipate some more. So this has been closures as well as consolidations, of which we've seen a number of across Greater Manchester, and probably is going to be some more going forward. Also last year, there was some real pressures which were very different. We had the pressures of Brexit, we had the pressures of stock availability, and a very volatile market around pricing, which was then further impacted with when COVID and the pandemic around January, February, and they were affecting the supply chain. So towards the end of the year, we saw some especially for the second part of last year, the second 6 months, we saw some real challenges around the supply chain and what the costs were to contractors on running businesses. We obviously continued our work around working with commissioners and really, pushing for community pharmacy and fighting their corner to make sure that the services that have been announced within CPCF were well aware. So CPCS and engagement locally with commissioners, and also the 111 service to make sure that they understood community pharmacy and its offer were part of our work, and that's put us in good stead for this year and the GP-CPCS rollout that we're going to see in the autumn and November onwards. We've done some considerable work around TCAMs, so the transfer of care and medicines, with a lot of the trusts and hospitals working with Health Innovation Manchester, who were supporting the rollout from the trust perspective. And again, that standard is in real good stead for the discharge service, which we anticipate has been obviously pushed back due to COVID. We anticipate to be launched in the new year. And we have a very good infrastructure already in GM for that. Obviously, we've had a number of issues around the services that were delivered from community pharmacy around EHC, minor ailments, and the like, and how they were delivered under COVID. We obviously responded very quickly and worked again with commissioners to remove to remote consultations where we could, ensuring that there was a continuity for community pharmacy, and also working with the substance misuse providers, where supervised consumption services were stood down, but then obviously that was a massive impact for a lot of contractors from a financial perspective. And again, we worked with those with those commissioners to ensure some form of financial stability in all the localities covered by GMLPC. Also looking around processes with the NHS England, when it came to notifications around closures or notifications around reduced working hours, we stood that things up very, very quickly, and also access to testing for community pharmacy and frontline workers and their families, very, very quick responses. So these are all work that we actually did towards the back end of 1920, but a key part of what the work is going forward. And I think also it's fed into the work that we need to be doing this year, which is around the recovery for community pharmacy and building back better, and what the learns have been from this, and ensure that we've got resilience within our sector and our system going forward. It's also forced a lot of engagement. So areas where it's been difficult in the past to engage, they've stepped forward. They've needed community pharmacy, and they've seen community pharmacy response, and we're bearing the fruits of that engagement now. and hopefully we'll be able to build on that going forward. Obviously, our strategy itself hasn't really changed. We're still, leading pharmacy through devolution, looking to support practice and developing future services all the time, but also championing and promoting community pharmacy. The work streams that sit behind it, they have been obviously realigned to look at what we need to do. So where we look at primary care networks in work stream 4 was building on from last year, and then work stream 2 is around workforce development and the number of opportunities that we're trying to enable for community pharmacy, and make sure that the community pharmacy has the awareness around what is available for workforce development, but also putting in what the priorities are for us to be able to deliver and build that better. Again, an overview. These slides will be available for you to review later on, but again, it just gives a bit more information around there. Workstream 3, which is around maximising contractor income, and this is around service and service dashboard. So we have developed last year a service dashboard, which was due to be launched publicly, as into yourselves as contractors, around April, but with COVID we thought we would pause that because as we had other priorities. But the service dashboard is all around looking at opportunities and looking at benchmarking data against your peers, not necessarily identifying who your peers are, but where you are performing in line with others when it comes to service and service provision, and then looking at what the barriers to service position potentially are, and how we can work with you a lot more closely to be able to deliver those. And then also it helps support the GM commissioning model and the work with CHL, the provider company, who we've worked obviously continually very, very closely with over the year. And one of the actual intentions that we set out with when GMLPC was formed was for CHL to be able to stand up on its own 2 feet, and we are in a very, very, very strong position with CHL, where actually year on year currently they are self-sufficient. So the company itself is able to stand up on its own 2 feet as we currently speak, which is great news. In terms of the 6-month levy holiday, we've already discussed that. We're also looking at directed support for those people around PQS. We've had the second announcement now. We did a lot of work in January and February around the PQS, and especially the PCN lead element. And we were, fantastic. We actually had all 58 PCN leads, and we were able to maximise that income for community pharmacy last year. And the targets are for us to do the same this year. There's some onerous work that needs to be done. There's a lot of networking and engagement that the LPC needs to support the PCN leads with to ensure, especially around flu, but also how we can streamline any processes where it comes to your staff and the criteria that you need to be fulfilling. And we'll be putting that support material out there for you. We've got a number of bulletins that now go out. So we have 3 weekly bulletins. Hopefully you've all signed up and you are utilising them and using them for what they are, and making sure that you're fully aware with the work that we're undertaking, but also the development and service opportunities that we're presenting for you week on week. So talking about the operational structure, bringing Ifti Khan, who's our vice chair, but also our governance lead, and he'll be able to talk you through what's the operational review that we talked about last year, what the outputs of that have been, and the operational structure that we've now developed.
Thank you, Andy. So I'm Ifti Khan. I'm the vice chair, and I'm a CCA member on the committee. If you recall back to the last AGM, we outlined a new GMLPC structure that we were moving to. The proposed structure would bring clearer accountability and delivery. Unlike other LPCs, we introduce clearly defined specialist roles, separating strategic leadership and management, and also introduce the concept of senior responsible officers, SROs, as subject matter experts. And that was in key areas around primary care networks, services, communications, and engagement. We recognise that these 3 areas were fundamentally really important to contractors. And primary care networks, if you look at that as an example, how important that now is in PQS. We used a defined process in ensuring that we recruited colleagues with the right skills and expertise to allow us to develop a high-performing team. I need to go on to my next slide, sorry. Just do that. There we go. Sorry about that, technical issues. The screening, interview and selection process we used ensured we had a robust process to only appoint to the roles when candidates met the desired skills and competencies. An organisation is only as good as the people who work there. And as a committee, we have done everything to ensure that we have a team who can effectively support contractors. Ultimately, we want to provide effective support to deliver our business plan that Anit's outlined, the strategic plan. The team have come in place at what is a very challenging, unprecedented and uncertain time and done a phenomenal job in supporting contractors. You can find all the bios on the website. That's not just of the committee, but also the support staff. So in terms of the structure, we've got names on there. So we've got the committee, we've got the board members, and the board members also are broken down into subgroups. So we've got subgroups around governance, finance, services, HR, primary care networks, and academy. And then the office team, supported, we've got office manager, James, and we've got the business support officers, Adam and Karishma. And then the director of pharmacy transformation, and we've got Lovejeet Kandula, who joined us from her national role at PSNC. And then Ricky, who many of you will already know because she was on the LPC previously as PCN lead, as senior responsible officer for PCNs. And Imogen, who joined us just a few weeks ago, who is our communications and engagement lead. And very shortly, Esther Burrows will be joining us from a services perspective. So we're really delighted with the team that we've got, and hopefully over the coming year, we can demonstrate how effective and how high performing this team is. If there is anything that we can help and support with, we really value your input and your feedback, and Imogen will be working on ways on how we collect that, particularly how we go out externally to demonstrate the value that community pharmacy can provide in Greater Manchester. Thank you, and with that I will pass over to Anit.
Thanks, Ifty. I was just talking to myself for a second then. So building on what Ifty's talked about and the key successes. So we've had the operational review as we've outlined, but then also the work that we've done during the course of the year. We've mentioned around the PQS, and we had 586 of our 609 pharmacies make successive claims through PQS, which was absolutely fantastic, and some massive income for community pharmacy and supporting them through that. We've got the GMMAS scheme, which was actually developed at the back end of last year. And it was due to launch on the 1st of April, which we had to pause because of COVID naturally. But that is ready to be relaunched again in this autumn. And that GMMAS scheme is looking at standardizing the service that we've had. We've had it in 5 of the localities already, but some other localities are operating their own service. This will then be a service that runs pan-GM, where patients will be able to access services. So, for example, if they lived in Salford, they will be able to access the MAS services in Stockport, and vice versa. So, as long as they're living within the localities and accessing it within that, they'll be able to do that. That was a significant piece of work to get all 9 of our CCGs on board to agree to the service and one standard service. So a big win for us there. I already mentioned the appointment of the 58 PCN leads across Greater Manchester to support PQS, but the big bit has been also around the PPE and the COVID-19 testing access that we stood up very, very quickly towards the back end of last year, and the actual support webinar that we ran for contractors at the back end of March to be able to respond in the best way that we could. We also secured significant funding for the GM Healthcare Academy, which has allowed the Healthcare Academy to be able to stand up and look now to employ. It's already taken on some staff directly for itself as a structure. Some of you have already seen the platform, which I'll be talking about in a minute as well, and make sure that you're onboarding on the GM Healthcare Academy platform. Looking at flu, so we've obviously supported with flu support and flu delivery. The Healthcare Academy had flu training running as well recently. So last year, if we look at in GM, we had over 75,000 vaccinations. I anticipate us going way beyond that. I was going to try and get a figure for you today, but we were unable to get into the dashboard. But last week, if we look at a year-on-year comparison, at the point where we had done 6,000 vaccines last year, we were on 26,000 for this year. So community pharmacy is responding and responding very well across Greater Manchester, and we are delivering vaccination services collaboratively, working with GPs in areas, operating drive-through services collaborative with them as well. It's been fantastic to see some of the work that's being done on the ground, coordinated at PCN level. But the main thing is that we are responding, and we are fully aware that there are some challenges around vaccine supply that are starting to come, but that's obviously because of the demand and the service taking off as well as it has. So hopefully we'll be able to continue to keep up with that as we go forward. Some of the obviously working lean that we've done over the last few years has allowed us to invest back for contractors in the best way that we can. And some of you may have seen and heard some of the advertisements that are currently going on in the media, both on social media, on the radio, in and around the city, around the flu campaign and accessing in pharmacy. I'm able to give you a quick sneak preview on this now. Hopefully,
thinking about getting.
Go. Oh, I'll go back one. I'll try again.
Thinking about getting a flu jab this year? Not sure where you can get it done? Did you know that pharmacies can give free NHS flu jabs to eligible people aged 18 years or over, and this could be you? So think pharmacy for all your family's healthcare needs, and ask your local pharmacy for details today.
So that was a sneak preview of the advert. This is obviously running on radio. It's also running around the city on large billboards. And then also what we have done is we have looked to have this translated. I think there's only one language left for it to be translated into, and we'll be sharing it with community pharmacy. So you're able to play it within your pharmacies on your screens as well in a number of different languages that are prevalent across Greater Manchester. I think we've got 4 or 5 different languages that it can be that it can be shared in. So looking at what we want to be doing moving forward, obviously there are continued financial pressures, but we are working and we're feeding in constantly nationally as well around what the challenges that we've seen and what they are on the ground to push for these to be addressed on a national level, but then also looking locally to see what we can do around service and service development, but also working around innovation and working with Health Innovation Manchester. And I've already mentioned the TCAM project, but that's not the only one. There's been a number of different ways that we've engaged with them around different services to try and increase income for community pharmacy through different services and opportunities, medicine shortages, and outlining them to the CCGs and medicines optimization teams. We rely on that information from yourselves as well on the ground, so please continue to share that with us so we're able to engage. And also we worked very closely with many of the CCGs in Greater Manchester around periods of treatment, especially when COVID in March, and we did see in some areas changes to periods of treatment. That wasn't the guidance that we had collated with all the stakeholders. So again, if there's anything like that, please do share it with us so we're able to support you and engage with the prescribers and the meds optimization teams on the ground. I think one of the big things for us is around PCN working. So hopefully many of you have been involved in PCN calls, PCN WhatsApp groups that may be facilitated by the LPC or by your PCN lead. I can only urge you to engage. because it's really, really important that we do start looking at how we collaborate and partner together. Yes, we all have businesses and we all, look to compete with each other, but without collaboration and partnering, we're not going to be able to move forward with a lot of the service offerings that we want to, because they are looking at PCM footprints. And if you look at the PQS for this year, it's already moving us, trying to push us towards that kind of working where we look at business continuity and buddying up systems and making sure that we have that within our ways of working. The other bit is obviously that we're still trying to join up a lot of services I've mentioned around MAS, and then we managed to do that across Greater Manchester, but that's not the only service. Many other services are fragmented, and it not only makes it difficult for pharmacies, but it also makes it very, very difficult for patients, and ultimately whatever we do is for patients. So it's making sure that we're able to do that. We are working on a recovery plan with the Health and Social Care Partnership right now, and looking at the priorities and what it is that we've learned from COVID. You would have seen some of the national comments from Simon Dukes from the PSNC around contractors evaluating what it is that they're offering, and maybe re-evaluating those services that they do outside of the community pharmacy contractual framework for free, and whether they provide the sector any value, where there may be commercial value, and we actually drive ourselves, are they of value to us as a sector? Do they provide us the right leverage when it comes to discussing what it is that we want from the government? So for example, we had the pandemic delivery service stood up, which is in turn been now stood down as well. But then if we were to go to the government around a delivery service to community pharmacy, because it's an identified need, from a commissioner perspective, they would obviously look at it and say, well, why do we need to commission something that's already being provided for free? So these are the kind of things that we need to be thinking about as community pharmacy, that are they financially viable? Do they provide us with the income that we expect and value for our profession and our sector, and how it is that we want to be running our businesses in the future? Okay, so from the GM Healthcare Academy, just to give you all a quick update on where we are. Obviously, many of you will be fully aware of the Healthcare Academy. It's a partnership of Bolton LPC, GMLPC, CHL, and also the GM Health and Social Care Partnership. As I mentioned, we secured funding, significant funding for the Healthcare Academy, for it to be able to look to start employing and providing training ongoing for this year and beyond. So many of you would have received emails around engaging with the Healthcare Academy and setting up your accounts. So for those that haven't, we have sent out invites. We did initially in March, but unfortunately this coincided with the starting of the pandemic, so it may have lost. Everybody was very, very busy, but in the last week or so we have done this again, and these have come out to your NHS mail shared inboxes for you to onboard with the GM Healthcare Academy online learning platform, which is a fully integrated solution around all your learning needs. It has individual accounts that can be attached to branches. These accounts for staff stay with staff, irrespective of where they are. If they move from branch to branch, from company to company, it is theirs. It is their learning passport. Can be used also for CPD. Many of you may have used some of the very similar platforms in other walks of your job, be it with other companies and other providers. The essence is very much the same, but what this does allow you to do is we are able to push it on a GM perspective on what the GM training is and what services are going to be being launched. A lot of the training will be referred back to the Healthcare Academy. So even those that have accounts with other providers, such as Newmark or maybe the MPA, you are able to merge those accounts into your GM Healthcare Academy learning platform as well when you bring your account over, as long as you use the same email address that's within that. So there is a couple of things that we have seen a couple of challenges on the onboarding, is around the use of NHS emails. So when you're onboarding, please do not use your branch email address as your personal address. Please follow the instructions to set up your branch email address separately using the access code, and avoid using NHS email addresses. There seems to be an issue with the platform sending out emails via the NHS firewalls. So at the moment, please try not to use NHS email addresses and use any other one that you may have. That's the only feedback that we've had so far as an issue. But then what you're able to do is register using the access code sent to your branch, and then we'll be able to then set up your, at the back end, as we see this come through, we will set up the administrative status for you. If there are any issues and you're finding any problems, then just please contact us at the Healthcare Academy email address, which is on the website. Okay, so the final bits for me are around, obviously, moving forward. It's going to be very, very challenging, but you know, we've already talked about the stability that the 5-year settlement has brought for the sector. It allows us to build. Certainly not going to rest on our laurels and be happy with what that settlement is, but it does bring us that stability, especially when we've gone through 3 years of cuts after cuts. At least we know that we have a starting point to be able to build from, but it is about what we want to build. And that's although we rely on national negotiations, that does also then depend on us on the ground and what it is that we are delivering and what it is that we intend to deliver as well. There's a lot of opportunities around pilots and service to be engaging with within the new CPCF in phase. Obviously, that's been slightly delayed with COVID, but they are still coming through. Hep C screening has already been launched, and we see the GP-CPCS in the autumn. It's really important that we are engaging with these services and providing them to the best of our abilities, and also maximising the PQS income, because these will be providing the stepping stones for us to go forward. I'm probably going to get in trouble because I was supposed to alert you all to a link that should be popping up into the chat box, which will allow those of you who have not voted in support of the accounts and the annual report to do so. So I think Karishma is going to share that now. For those that haven't already voted on the annual report and the accounts, if you could do so just using the link in the chat box, and then we will collate it with the votes that we've already received prior and announce the results of the AGM. And on that note, I'm going to move to Q&A. So if there's any questions on the accounts. Doesn't seem to be so, which is great. So the vote results are in. The total number of votes was 245, of which 100% have voted to accept the Greater Manchester LPC annual accounts for the year ending the 31st of March 2020.